Hi, my name's Grace. I'm your student nurse. We're just going to be doing a peripheral IV today.
Registration.
Can you go ahead and check your name and date of birth for me?
My wristband is wrong.
Harlan Samuel. Alright, these birthdays don't match up, so let's go ahead and get that fixed. Registration.
Just a moment.
Right.
Perfect, thank you. Alright, Mr. Harlan, you got that fixed for you.
Mr. Harlan's birthday is incorrect. Okay. 3/14/86. Perfect. Okay. Alright.
Okay, so what I'm going to do is
And then, Mr. Harlan, do you have any allergies? Looks like allergic to... Okay, so my sheet says that you're allergic to hydrocodone and Benadryl. Your band says that you're allergic to red dye. Which of those is correct? Okay, you're not allergic to hydrocodone or Benadryl, so, but you are allergic to red dye. So we'll leave that there, and I will get that information updated. And then I would raise up this bed to a good working height and take down the bed rail so that I could access their arm. But for the sake of these wires right here, I am not going to do that at the moment. Alright, we're just going to be doing an IV insertion today. So it's going to be a big stick into the arm. You're going to have a needle go in, but it's going to come out the catheter. The little plastic tip is going to stay inside. And then that way we can give you fluids, we can give you medicine, whatever the doctor orders, all right? Do you have any questions for me? No? Okay. So what I'm going to do is I'm just going to work on getting some of my stuff set up. And while we're doing that, can I ask you a couple questions, okay? Do you have a history of breast cancer? No. Any lymph node removals? And if so, from which side? Have you ever had a CVA? So stroke, heart attack? No. And do you have any dialysis ports? Okay. Just gonna assess the skin integrity. Skin integrity looks intact. I see no edema, lesions, no swelling, and no visible tattoos. Right. Actually, let's just go ahead and we'll raise this up to a good working height until we can't raise it anymore. Place that there. Okay. Just ripping this tape. that did touch real fast, so I'm just gonna grab a new one. Because it fell. And set that there. Well, there we are. Right. Just gonna prime the tubing. Perfect. Okay. All right. We're gonna go ahead and make it and assess for a good vein. All right. All right. Okay. We're gonna get ready to stick, okay? Just gonna anchor, big stick, 1, 2, 3. All right, I see blood return. Just gonna advance a little bit more and then push catheter in while retracting the needle. All right, gonna go ahead and attach that flush. Do that up a little bit so we can secure it a little bit. All right. All right, I've aspirated. Gonna go ahead and flush. And then while under pressure, I'm gonna go ahead and clamp that tubing. Oh, beautiful. All right. Now, I lost my needle. I dropped it. Okay. I'm gonna go ahead and clean this up, and then I'll show the blood return to the camera. And then on this ticket, I'm just gonna put my initials the day and time, the gauge of needle and catheter I used. And then we're gonna go ahead and secure. Secure that. All right. I do believe that that tourniquet may have been on longer than a minute. I got blood return. Released the tourniquet, got it all secured. And then I'm going to exit the room. I'm going to come back in. Knock, knock, knock. That would have gone into sharps. And I'm just going to confirm your name and date of birth. Right. I'm just going to be taking off your IV today. Oh. All right. Okay. I'm just gonna start by releasing this off. Perfect, you're doing great. All right. All right, we're gonna take this out. 1, 2, 3. Catheter is intact. Applying a pressure dressing. Okay. I'm just gonna go put this over here in the sharps. All right. Mr. Harden, I just want you to keep an eye on that area and just watch for any swelling, anything that looks like it may be infected. If you're having any abnormal pain, just keep an eye on all of that for me. And then I'm going to go ahead and lower you down. Call light is within reach of the patient. Lowering this. All right. You have a good day, Mr. Harden. Thank you for your time.